I'm Sandra. I'm your nurse. And can
Hi,
you tell me who you are?
hi Sandra. I'm Yoveda. I'm a level one student. My name is Yoveda.
Oh, great. Nice to meet you, Yove. I understand you wanted to get an SBAR report on our
Yes,
patient.
please, can you do that?
Okay. Our patient's name is Glenn Light. He's a 67-year-old male. He has no known allergies. He's a full code. He's about 171 pounds. His doctor is Dr. Phillips. So he came into the hospital. He has problems with his blood sugar level, and he has an ulcer on his foot right now. So he has a history of diabetes type 1. He's also a medium fall risk because of his right heel ulcer. His pain level is at a 1. He's alert and oriented times 4. His gait is steady. So respiratory, he denies any cough. He has clear breath sounds bilaterally. His O2 sats are 96. His respirations are 16. Cardiovascular, he denies chest pain. He has a heart rate of 76. His BP is 128/70. He has a S1, S2 sound, no murmurs, no breweries, no thrills palpated. He has a regular rate and rhythm. GI, he denies any nausea. He has bowel sounds present times 4 in each quadrant. GU, he denies any problems urination, and his last urine output measured was 320. So right now we're waiting to hear back from a wound consult. We want to get some pain management with him. We want to teach him about his diabetes, and we want to teach him about glucose, getting that under control. So on his right heel, he has a stage 2 pressure ulcer. It's 3 centimeters deep and it's 5.5 centimeters wide. It's pink and it has serous sanguineous drainage. And he has 2 meds that are going to be due, and you can come in the room and we can give those together. He has 2 insulins. He has an NPH mixed 50-50 with a regular, and he has a Humalog. And his blood glucose rating last checked was at 290, so it's really high. And we can talk about some more charting after we're done giving him the med.
Okay, Sandra, can I just ask you some questions? Why specifically is this client receiving this medication?
His glucose levels are extremely high. They're at 290.
Okay. What action does the medication have on the body?
So this medication, it's effective with glycemic control in diabetes patients. It regulates glucose metabolism and it lowers blood glucose by stimulating glucose uptake by inhibiting the hepatic glucose production.
Okay. When should you question administering this medication?
So we should question giving the medication if his sugars are too low, so if he's in hypoglycemia, and then also if his vitals, so you want to monitor his vitals, you want to check his labs. Those are things that we need to know before giving the drug.
Does this medication have a therapeutic serum level?
Yes, it does. I don't have that right now, but we will go look that up, that drug.
Okay. Which vital signs must be monitored?
We need to monitor his urine output, his vital signs, so his blood pressure, his pulse, his respirations, and specific gravity.
Which physiological parameters should you be monitoring when the medication is being administered?
So we want to know what his potassium levels are. We want to check his labs, his A1C. We want to monitor his glucose every 6 hours.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, we want to make sure that we're able to give it to him in those different sites, that he's able to have it sub-Q if he's able to take an injection, and we want to rotate those injection sites. And then seeing if he's eaten anything, how he's handling his diet, how's his appetite.
What intervention must be taught for taking medication safely at home?
So he needs to know how to check his own glucose levels at home. He needs to know how often to check them, and he needs to know about changing his sites of injection so he's not injecting the same place. And then he needs to know signs of hypoglycemia. He needs to know signs of hyperglycemia. He needs to know correct storage of the medication. He needs to know also when he goes to inject himself that he should clean his skin or use alcohol. And then we'll give him some pamphlets on that information.
What are the side effects and potential adverse reactions?
So you have a potential of being hypoglycemic, hyperglycemic, and then also hypokalemia. So that's low potassium.
Okay. How will you know the medication is effective?
When we gain control of his hyperglycemia, because right now it's really high.
Okay. Thank you, Sandy. That's it for now.
Okay, great. So if you want to come with me, we'll come into his room. Knock, knock. Hi, hello,
Hi.
Mr. Glenn. I have a nursing student here with me. Her name is Yoveda. She's just going to be watching me give your meds. You do have some insulins that are due. If you can just confirm your name and your age for me.
Glen Light, 67.
Okay, perfect. And that matches up with our chart here. So, Yoveda,
Mm-hmm.
we
Yes.
have the medications here that we have to give. So we're going to give 2 insulins. One is an intermediate acting insulin and the other one is a regular insulin, so it's like short acting. So we're going to come in and always want to wash your hands. Okay, so he's had a history of diabetes, so we're going to make sure that we give him client teaching. So, Mr. Glenn, can you tell me 2 side effects of hypoglycemia?
Yes. I can get nauseous. I can be vomiting and shakiness.
Okay, that's great. How about hyperglycemia? Do you know any side effects of that?
Yes, because I get them all the time. A headache, blurred vision, and weight loss.
Okay, well, there's a couple that we'll discuss more about, but that's great that you know those so far. Okay. Okay. So, Yoveda, we click on the MAR, and this is going to tell us exactly when to give and what to give. So we have a Humalog is actually due now. This other insulin, the NPH, it's saying that it's due, but there's no green light. So if it doesn't have a green light, we can't give it. Then we can't give it. I thought it was due. Okay, so now we're only just going to be giving 1 insulin. So we're going to give them the Humalog, and we're just going to check our drug here that we pulled from the Pyxis. So we have Humalog, and we're confirming the right drug with the MAR, and I'm checking the expiration date. It's 2018. You see that?
Yes.
So we're good on our expiration date. So here we have subcutaneous, so right route. Mr. Glenn, can you take a subcutaneous injection?
Yes.
Okay, great. And then it just says here 4 times a day, so that's time. And the time that it's due is at 2100 and at 1700. So it's actually 1701 now, so we can actually give that now. Okay. All right, so Mr. Glenn, can you
Yes.
confirm your name and your date of birth or your age for me?
Greg Lynn, 67.
Okay. Confirm that with the MAR. And do you have any allergies?
No, ma'am.
Okay, I'm going to confirm that with the MAR, and it says no allergies. So we're good on that. So we've got our right drug. We've confirmed it with the MAR. Okay, so now we're going to scan everything in. So we're going to enter in his information. Here, you just want to read it to me.
6502 555 339.
Okay. So here it's confirming that Glenn Light. So we have the right patient coming up. And okay, so we're going to do our scan our barcode. So we'll just enter in this information. Okay, scanning. Okay, so now we are giving, okay, so it says here on a sliding scale. So Mr. Glenn, his glucose was okay.
6502
Mhm.
555
Mhm.
339.
Pull that up. 9 B C 98 E B 98 3651. There we go.
The green.
There we go. Okay. So we're going to do a sliding scale. So last checked, his glucose was 290. So according to here, it falls under the range of 6 units. So blood glucose, if it's between 251 and 300, you give 6 units of the Lisapril. So we're going to give 6 units. So we're good on that. So we know the correct dose. And we've confirmed that with the MAR. Okay, so we'll go ahead and clean it with an alcohol wipe. Okay, we're just going to push 6 units of air into our vial. Okay, we're going to draw up our drug, and we want to make sure we don't have any air bubbles. Okay, and I'm gonna let you confirm that we have 6 units.
Yes.
Okay, perfect. All right, so now I'm going to carefully scoop. Okay. All right, so Mr. Glenn, do you have a preference on where you would like your injection?
My right side, please.
Okay, so your right side. Okay, perfect. Okay, so I'm gonna go up here in the upper quadrant area. We're gonna clean the area very well.
Today, A1C is 6.5.
Okay, so Mr. Glenn, you're gonna actually take your regular insulin injection. This is the Humalog. This is the one that will kick in 30 minutes to an hour. Okay, big stick.
14.5 is the hemoglobin.
All right, perfect.
Sodium is
There we go.
141.
And we're gonna put that right in the sharps bucket. And how did you take that shot?
It was okay.
Okay. All right. So now we're gonna go in here and we're going to say that we administered it. Okay. And then we gave the glucose, blood glucose.
Why specifically is this client receiving this medication?
Was 290. Injected 6 units of insulin, subcutaneous, in the right upper quadrant.
When should we question administering this medication? I would question administering this medication when the patient
Tolerated
when I see the patient's blood
well.
glucose is too low.
Okay, so we had 290 was our rating, 6 units was injected, subcutaneous in the right upper quadrant. Perfect. So then we're just gonna assign.
Vital signs pertinent to administration of this medication, but it's always good to assess the patient for needle checks and make sure there's no presence of edema or
Okay.
fatigue or
All right. So here it says we've given the drug. Okay, Mr. Glenn, remember those side effects that we were talking about earlier? You were pretty good at naming them off. I do have some diabetes management pamphlets for you because we do want to get your glucose levels under control. And then also we're going to do a wound consult with you. So with taking care of this at home, it's important that you rotate your sites when you inject. So do you know about rotating your sites? Do you have any questions with that?
No, thank you.
Okay, do you know how to store your insulin at home?
Yes.
Okay, and how would you store your insulin at home?
We'll store it in my bedroom where it doesn't get moisture. Make sure it's nice and clear and clean it really well with the alcohol.
Okay, so some insulins you actually going to store in the refrigerator. And then yeah, you want to make sure you clean your skin with alcohol, or even you could use soap and water. That's just good hygiene. And then do you have any other questions or concerns?
No, thank you.
Okay, so I'm gonna put your bed back down, and you just call if you need anything. You have your call light, and if you need anything else, you just call and let us know, okay? All right, you take care.
Okay, Sandy, can I just ask you a couple more questions?
Mm-hmm.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we needed to know his A1C levels, we needed to know his vital signs, we needed to know his lab results, and we needed to have his glucose measurement, which we did, and it was 290 and it was high, so we needed to administer his insulin.
Did this information affect your decision to administer the medication?
His vital signs were stable, so we did not have to do anything about that. And his glucose levels were high, so that's why we went ahead and gave him his insulin.
Does this information affect how you administer the medication?
Yes, it would. If he had hypoglycemia, we would not have given him that insulin medication. And then also it's important to know what his labs are and how his vital signs are when we go to give him the drug.
Okay, that's it. Thank you, Sandy.
And you can come with me and we can go chart together.
Okay, thank you.
Mm-hmm.